diagnosis of arthritis?
No. Let me clarify that. The lupus won't be a sign of arthritis. It will be arthritis. So lupus generally means systemic lupus erythematosus, and the systemic part just means that different parts of the body are affected by lupus. So lupus could affect the skin, the kidneys, the lungs, and the joints could also be part of it.
Yeah. Still on that question, that question of diagnosis, how do you diagnose arthritis?
Okay, so again, we'll refer back to the types because depending on what you think the cause of the arthritis is, once the doctor sees you and they assess you and think they have an idea generally after examining you what kind of arthritis you could be having, then they'll do various tests. So most commonly for osteoarthritis being the most common type where with age the joints are wearing out, that we start with just doing a plain X-ray. And usually the X-ray will show some changes in the bone that then point us to the fact that you have osteoarthritis. On top of it, for things like, we do other tests, other blood tests, so we'll check for what we call inflammatory markers. So these are, let me call them chemicals just to make it easy. Chemicals in the blood that will increase when you have inflammation in the body, and that can point us to arthritis. For something like rheumatoid arthritis, because it has genetic factors that play a role, then we do tests like rheumatoid factor. If we still think that that could be what is going on, the other tests that we check for antibodies in the body, because rheumatoid arthritis is an autoimmune disease, so we check for certain antibodies that point us to the fact that you have rheumatoid arthritis. Gout is caused by increased a salt called uric acid. So it builds up in the body and then it forms crystals, like salt crystallizes and deposits in the joints. So in that case, then we check your uric acid levels. Even an X-ray for very advanced gouty disease, you may see those deposits, but that's a very advanced type of gout. In septic arthritis, which is an infection, we'll do the X-ray. We could do an ultrasound because there's a lot of joint fluid that accumulates due to, it's kind of like pus accumulating within the joint. We'll check for infection in the body, in the blood, that is, and then even that fluid could be aspirated, meaning drained from the joint, and several tests done to ascertain what kind of bacteria is causing the septic arthritis. Yeah. And
when you talk about these types of arthritis, we have gout, of course, osteo and RA, which you've said are the top three. So which one are we seeing more prevalent in the country?
In the country, you'll see mostly osteoarthritis, and that's affecting middle-aged and above, so 50, 60, 70-year-olds will present with osteoarthritis. The reason being, osteoarthritis happens to be wear and tear. Let me use that for the general public to understand. So with time, there's loss of cartilage within the joint. And cartilage basically refers to, for example, what makes up the nose or the ear. It's not necessarily flesh and it's not bone. It's like a padding of cartilage within the joint. And with time, it wears out due to use with age. So it wears out and you start feeling that the bones are rubbing against each other, and that's why you have the symptoms of pain, stiffness, a lot of discomfort when walking, and so that happens to affect mostly the elderly, and that's the most common type that we have in our setting in Kenya. All right,
so how do they present themselves differently? When you talk about gout, osteo, RA, of course I know they come with different signs, symptoms and outlook. Yeah. So, and I don't want to ask which one is more painful than the other, because if we're talking about arthritis, then it could present itself with pain. Yeah. But how do they now manifest differently, gout, osteo and RA?
Okay, I'll start again with osteoarthritis, our most common one.